Thousands of years ago, Greek philosopher Aristotle spoke about quality of life. In his work Nicomachean Ethics, he said that quality of life meant being well or being happy. Today, well-being and quality of life have evolved to encompass all domains of life, such as biological, psychological, social, and spiritual. Psychological factors are considered to be the strongest predictors of gaining an optimal, overall, health-related quality of life. There are a lot of advances in the diagnostic and therapeutic parts of treating chronic diseases. Healthcare professionals treat the symptoms of the disease and tend to focus on the body, but they forget about the psychological needs of the patients. A chronic disease disrupts a patient's life and causes changes to him and to his family. Some of my patients say, I feel depressed, I'm anxious all the time, I have to pay for my healthcare costs. An integrated approach, which is what these patients really need, includes and requires a psychologist. The psychologist impacts the patient's overall well-being by giving them back their voice. This can be achieved by listening to what the patient has to say and be treated with respect, unconditional acceptance, and empathy. I have worked many years conducting the holistic approach, and I have seen that the psychological outcome of the patients is improved by far in comparison with the biomedical approach. In this context, I've used psychoeducational programs to educate patients about their disease and help them to adjust to the new situation. I have helped patients to quit smoking, follow medical instructions, take their medication, and educate them to reduce postoperative pain. This can make the difference between a successful surgical intervention and an unsuccessful one. For me, it's clear that there needs to be a holistic approach for the treatment of chronic disease patients. The psychologist can be the leader of a large team consisting of the family of the patient, the healthcare professionals, and the patient himself to improve health-related quality of life. This integrated team can work together and use individualized approaches because each patient is different. Each patient has different needs, strengths, and weaknesses, which must be addressed holistically to help them not only to live longer, but also to live better. As Carl Rogers, the founder of a person-centered approach to psychotherapy, said, a psychologist in a working environment not only manages problems, but helps to make the environment more human. As a psychologist working with chronic disease patients, I say that a more human environment is a healing environment.